Good morning, everybody. And thanks very much for taking some time to join us on relatively short notice. Maybe I'll just begin in our customary way by acknowledging we are privileged to provide care on lands that Indigenous peoples have called home for thousands of years. We've called this special town hall today because things are moving so quickly with the Omicron variant. Probably like many of you, I have to admit, I thought I was beginning to see some light at the end of the pandemic tunnel, but unfortunately we're facing this additional and very significant wave. And it's hard to know exactly what it will mean for us, but it could well prove to be the toughest one yet for our healthcare system. But of course, we'll just have to wait and see. Yesterday, our HNHBB hospital CEOs convened our incident management table to review recommendations from hospital leads on critical issues affecting this sub-region. I do feel that the hospitals across HNHBB have done all that we can at this point in time to try to prepare ourselves for this additional wave that's headed our way. That we will try to do our very best to be thinking and acting like a hospital system, to be assisting each other as we can in terms of load leveling and resource sharing and so on, as we enter into a really challenging time. For sure, across the region, protecting and preserving health human resources, I'll say a primary concern. As Omicron continues to spread through the community, the need for healthcare workers to isolate is exacerbating existing staffing shortages as more and more healthcare workers are becoming exposed. Yesterday, the province, in recognition of this situation, made the recommendation that healthcare workers who have been in close contact with someone with COVID need not stay at home as long as they continue to test negative for the virus. So that will certainly help preserve staffing levels to a degree, but no doubt still a very daunting period ahead of us. I'd just like to say, as we approach the holidays, please we can't let our guards down. I think more than ever since the pandemic began, we have to do everything we can to help keep ourselves and keep each other safe. If you plan to celebrate the hospitals with your loved ones, I really urge you to follow public health guidance to ensure you're taking all reasonable precautions to prevent the spread of the virus. If you're working over the holidays, I really hope and pray you'll find some moments in between work to find some time to recharge and to rejuvenate. We all know our physical and mental health is critical to our ability to continue to work. And I know, the whole of the HHS leadership team is so grateful to everyone for all the hard work and all the sacrifice that you've been making for our community and for our region. So I'm going to turn it over to some of my colleagues to provide updates on the current situation at HHS, including protocols and processes for reporting, testing, vaccination, and so on. And then I will return back at the end to close off the session. So we'll start off. I'm going to start off by passing it on to Sharon Pearson, who's going to give us a review of how we're doing from an operational point of view. Sharon, over to you.
Great, thank you, Rob, and good morning, everyone. In terms of our status from operations across our sites, right now we have 42 COVID patients. Of course, that number can change very quickly, and it has. We have less than 5 patients in our ICUs, leaving approximately 37 on our units. Less than 5 ECMO, and then unfortunately we have several outbreaks in progress right now, certainly more than we've seen in some of the previous months. In terms of our pressures at the sites from an occupancy perspective, if you were to look at the bed board today, we would still see some very high occupancy. Despite that, typically we see a bit of a slowdown going into this pre-Christmas period, and we are in our surgical slowdown period. We continue to rely on significant unfunded and surge bed capacity to mitigate those pressures that we have in our EDs. So on any given day, we usually are running 60 to 80 unfunded beds. You can see our volume there today. Our ALC patients, again, you can see the range. We were sitting several months ago closer to 140. So we are seeing a rise in our patients waiting for an alternate level of care. Again, the occupancy at an aggregate for the adult sites is 96%, but the range is significant across the adult sites. So we see the Juravinski sitting as high as 105 and 107%. And again, the McMaster and the children's site, you see the occupancy at 91%. I would emphasize, though, the occupancy rates can be a bit misleading, and certainly the pressures are very intense across all of the sites right now, and we're seeing particularly high volumes. And as I've reported previously, we've certainly returned to our pre-COVID volumes at this point and seeing a higher acuity in the patients that are arriving. The outbreaks that we do have in progress right now, there's one at the Juravinski on E3, at the General on 8 South, where patients were consolidated to yesterday, the Satellite Health Facility on the 4th floor, and the West Lincoln site on C Ward. And we are redirecting right now the obstetrical patients from McMaster to Niagara as a result of that outbreak. So the pressure is significant for West Lincoln as well, with a small bedded footprint and a large outbreak. From our challenges, I know from those that are listening in today, you're all well aware we have precarious staffing situations across our sites with the impact of the outbreaks and the impacts on staff and exposure to family members as well. The pressures with the ambulance offload and our admit no pressures, of course, as a result of our occupancy, are sustained. There are a number of strategies in place to try to mitigate those, including submit avoid strategies, and working with our ministry partners about ways we can make some system changes to assist with the pressures we feel in our Hamilton hospitals. But again, we continue to see high volumes in the EDs. We are working with our primary care partners as well to see how we can mitigate some patients that perhaps could use other services other than the ED, and working with our post-acute partners to see how we can enhance those services as well. And then in terms of, there's lots of conversation, Rob referenced the regional conversations in place. We do have a group that continues to support, as they have through wave 2, 3, and now 4, looking at how we can ensure we have access to our hospitals across the HNHB in the Ontario West region. Identified priority populations are here. Of course, critical access is necessary for this group. We do have our census balancing algorithms in place again this time. We have very responsive partners in the HNHB that have responded to HHS and the pressures that we felt to date, and they will continue to do that as best able through this next wave that we have. So lots of activity happening and efforts to try to manage the pressures that we are intensely feeling across our sites right now. Thanks, and I'll turn it back to Rob.
So
thanks very much, Sharon. And we'll pass it over to Les Gauthier, who is going to talk about both, I think, Directive number 5, Les, and PPE.
Correct. So good morning, everyone. So there's been a lot of communication through our public relations team this week around the amendments to Directive 5 that were issued. So people would have seen one communication come out Friday, and then again on Monday, we had to revise that message to comply with Directive 5. So really key message from Directive 5 is that the use of N95s is mandated for any of our patients and caring for any of our patients that are probable or confirmed COVID positive. So people need to wear an N95, and they also need to have a current fit testing of their N95 and also wear eye protection for caring for our COVID patient populations. The second key message is that medical masks are still our standard of care for patients who are not in precautions and not considered to be COVID positive or confirmed. The messaging around universal eye protection. So again, I'm reinforcing in caring for any COVID probable or confirmed, universal eye protection is mandated. There is information on the hub of what constitutes safe eye protection, and important that people realize the mandate for any unscreened patient population. So this is mandating eye protections for our teams in the emergency departments, our urgent care centers, the COVID assessment teams, and also labor and delivery. For other staff, universal eye protection, so not universal, but eye protection is indicated if you're caring for any patients who are in droplet precaution, who based on your own PCRA, you're at risk of a face splash, or for caring for any patient or caregiver or visitor who are unmasked. So even if those people have a medical exemption to be unmasked, the expectation is that you would need to ensure you have eye protection on if you're within 2 meters of those people. And the last reminder, and I'm giving this message consistently to my team, is we need to do everything to make safe choices. Where possible, minimize your time on site if you're in a role that does not have to be on site, and just to choose wisely in our personal decisions over the holidays. So there is a lot of information around PPE that's been available through the hub, and the PPE task force has reconvened, and we're committed to making sure as information changes that we get it out to our teams in a timely manner. So thank you.
Thanks very much, Les. We'll go now to Kirsten Kroll. We did implement, starting yesterday, a new visitor policy. So Kirsten, over to you, maybe to say a few remarks on that.
Yes, thanks very much, Rob. And I'll actually, I really want to emphasize that we should be now really calling this essential caregiver presence. It's really to flag that we are buttoning down much more than we have, going back to our non-low prevalence status, and really just hoping that we're only going to get our essential caregivers, or really people who are essential for that individual to be on the premises. So what is new as of yesterday is not only the restriction, but the emphasis on the vaccination proof. We expect all our essential caregivers to provide that proof of full vaccination. The bullet points there describe, as does our policy and what's gone out around what we expect as far as that evidence. We are still certainly accepting the paper versions, so the vaccination receipt that people may have received. And also, of course, for those who have migrated to getting their QR codes and the document on their mobile device. Of course, that'll be down the road, probably the preference, but right now we're fine with either of those versions. And I will say, for the most part, what I'm hearing today is that most people are coming prepared with that as they show up to our screening areas. So thank you. And of course, along with that is the government issued photo ID, much like many of us may be all used to now as we go to different locations. The third bullet point is really just to reemphasize that we're defining full vaccination as with the material that's posted on government sites. So that's nothing different. We are not looking for evidence of boosters at this point in time. Maybe down the road that does become part of the process, but right now we know people are just even scrambling to try and get their boosters. So time will tell, but right now we are sticking to the full vaccination definition, as we know from government, and same thing that we're seeing in the House as well. All right, next slide, thank you. It's not moving. Okay, there it is. So the exemptions, though, for individuals who are essential caregivers, are coming to screening, there are some exemptions. And again, they are for very much more specific events, primarily around compassionate reasons and individuals who have patients or family members who are end of life. The clinical teams certainly weigh into the acceptability of having an unvaccinated caregiver. there. Same with individuals who are very dependent, are patients who are very dependent on family members providing ongoing care. You know, special needs adults, for instance, where a family member has been an ongoing caregiver, you know, certainly exceptions for those individuals are appropriate. The compassionate grounds, as mentioned earlier, you know, life-threatening issues that are arising, a partner of a woman giving birth, the parents, of course, of pediatric children, and individuals also in NICU, and then individual visitors or caregivers that are coming to us who have a valid proof of medical exemption. There is good evidence of on the government sites around what medical exemption documentation should look like. So it should be a rare occasion that we're seeing an individual with appropriate medical exemption, but a written note that just has some basic information is not appropriate. Anyways, we stick to the guidelines that we're seeing in the government sites. Next slide, please. What is different then as far as the reduction of traffic on the premises, so beyond the vaccination status, which is important, we would now for our inpatients expect that there only be one caregiver at the bedside at any given point in time, but individual patients can identify 2 caregivers on their list, so that is a restriction. From the point of view of we're also not letting them change the names out. So the 2 names that are going to go on those lists now, they need to be consistent. And again, we want that consistency in the caregivers that are coming in, and also making sure that the units continue to get the contact information of those individuals. So if something is happening with an outbreak, like Sharon's mentioning today, we can also connect with them easily, but we do want that consistency. Children under 12 not permitted. If you look at the policy, there's a section 4.6 that allows, if you know, there may be an older child in the family that is, again, very involved with the care of their family member, that can certainly be considered by the team to come in. And we would certainly prefer individuals from the same household where they have common germs, really, that they're sharing to be in. And again, it just reduces some of that risk. So this is really all about not having the discretionary visitor coming in. You know, we're in past or in recent days prior, you know, patients could change their list much more often. It could be a neighbor from down the road that is more of a social visitor. We really are changing gears to what people would have seen in earlier waves. In the outpatient setting, it's really not much different than what we've had in past, other than, pardon me, that vaccination requirement. And there really should be very rare exceptions where somebody who is a caregiver unvaccinated coming in with an ambulatory patient, but certainly for the emerge departments and other ambulatory clinics and so on, again, we're sticking to exceptions for those who have very specific needs around cognitive mobility and emotional supports. And again, those areas can determine whether or not it's a very temporary access that caregiver is getting or not. Really want to emphasize that it's important that our people who are coming in onto the premises or essential caregivers, they must stick to proper mask use and follow instructions around IPAC. It is really critically important. All of us have a role to play. If we're seeing people on our premises outside our rooms, they might be getting just kind of traversing through the organization. If masks are under noses and so on, they must put them up. And if there is an individual that there is repeated messaging going through to them that they have to comply, it is time to ask them to leave and to escort them out if that compliance is not happening. It is critical that we see that compliance. And there are other expectations described in the policy around, you know, family members who are here for extended periods. They do need to eat and drink. But again, the controls that are required around, you know, pulling drapes, very temporary mask coming down to eat, drink, but they do not leave the rooms. The only other thing I would like to also emphasize is that we should also make sure that patients are offered masks, families offering the mask to the patient when they come in, just like care providers going into the room. Patients should don those masks as well, and making sure that they have access to clean masks. So I just want to emphasize that as well. All right, I think that was my last slide, and back over to Rob or to Michelle.
Yeah, thanks very much, Kirsten. So we'll go to Michelle Leroux, who's going to be talking about testing, boosters, and exposure guidelines.
Thanks, Rob. And for everybody on the town hall, this information is available and was released yesterday on the hub in great detail, because I'm going to cover quite a bit of content. So not expecting you all to memorize it as I walk through the slides, but it is available. So I'm going to walk through 3 different scenarios. So asymptomatic, if a staff or physician is asymptomatic and unmasked and has an incidental exposure to COVID positive person. What does incidental mean? That means somebody outside of your whole household, for example, is incidental. Complete the HHS online screening tool. I think we've all got the hang of that by now. Follow up with our HHS employee health services, and the contact information is there. And this is normally where I would encourage you, if you have any questions, please make sure you reach out to EHS, but I know you are. And thank you all for your patience. We have an exceptional EHS team who are doing their best to triage and get through the volume of calls. So thank you to everybody for your patience, and a little shout out to our EHS team for all they're doing to help us. Once you do that, please book a test, and the contact information is there of how you book a test immediately. And then again at 7 days. Much of this guidance that I'm giving today was from the Chief Medical Officer of Health, which Rob alluded to at the beginning. So they have shared this information with us this week about what the processes are for healthcare workers. If you have a negative PCR test, you may attend work, of course, using the PPE as Kirsten mentioned, but you must self-isolate otherwise. And EHS will give you all this guidance when you contact them. You will complete a rapid antigen test for 10 days following the first exposure. And again, we do have those kits that we will provide. Okay, next slide. So scenario number 2, very similar but slightly different. You're asymptomatic, but you've had a high risk, unmasked, and sustained ongoing exposure to a COVID positive person. So for example, someone in your household has been found to be COVID positive. So very similar steps, which you can see on the slide there. If you can, where possible, we do ask that you isolate from the known positive household contact as best you can. You may attend work following a negative PCR test, but again, must self-isolate otherwise outside of work. But in this case, you have to complete a rapid antigen test for 20 days. And that's again, following the Chief Medical Officer of Health's direction. Okay, next slide. So symptomatic, do not come to work, please. I know we've shared this since the beginning of the pandemic, so this is nothing new to everyone. Complete your HHS online screening tool, contact our employee health services team, book your test, and we've got some information there. You can walk in, if you're symptomatic and a healthcare worker, you can walk in with your badge to the testing center at 1565 Upper James Street. If it's negative, you can return to work once your symptoms have resolved, and the details of what that means are there. And again, employee health will walk you through all of this. If it's positive, you stay home, do not return to work, do not go out, and wait for directions for from our EHS team. Next slide. So if you develop any symptoms at any time overall, please self-isolate and follow up with EHS. I know testing is a challenge across Hamilton, across everywhere actually, but more good news coming, and I get to share it even though it's not mine, but more pop-up testing center is opening at Mohawk College today to everyone in the community. Appointments will be required, but I think it just speaks to the work going to the capacity to make sure everybody stays safe. Also, there's a great group of people working on expanding our testing options for our staff and physicians. This includes additional capacity at our West End clinic starting in a couple of days, December 26th, with prioritization of our HHS and our St. Joe's healthcare workers. Lastly, I know that our rapid antigen testing kits were very well received. Thank you all for your positive feedback, to Kelly Campbell and the team for helping us distribute it all. And more coming. So stay tuned for information from your sites about how, and you can obtain those if you haven't been able to already. And next slide. Boosters. Just a quick reminder of the boosters for our staff and physicians. You can now bring one family member to your upcoming booster appointment. You will need to show government issued photo ID for both you and the family member you're bringing with you, which is some great news we have to share. Next slide. I've just been asked to do a reminder around travel. And as we've done in the past, we are following the Government of Canada guidelines. We've got the link there. It's pretty clear the Government of Canada has said avoid non-essential travel. Regardless of your vaccination status, they released that as of December 15th. So we are sharing that with all of you as our staff and physicians. And traveling within Canada, we've got the link there for that information too. If you are traveling, again, if you're taking vacation, of course, vacation you get approved by your leader. If you are planning to travel, we ask that you share that with your manager and notify EHS. They will walk you through that. Again, reminding that avoiding non-essential travel is recommended by the Government of Canada. If you are required to self-isolate following travel, you will not be paid. That's been consistent since the beginning of the pandemic for us and our other regional hospitals. And just a reminder too, the Government of Canada website has some great details. It talks about even the risks of other jurisdictions imposing conditions, and you may need to remain abroad if you can't get home, that sort of thing. So you can see the rationale behind the avoiding non-essential travel there. So just our links, and again, available on the hub. And I think that's it for me, Rob.
Okay, yeah, thanks. Thanks to Michelle and thanks to all our presenters today. We did want to keep this morning's town hall, now almost this afternoon, short because it was called on short notice and so on. So we aren't doing some of the usual things like celebrations and Q&A and so on today. But maybe I could just finish by saying thank you, everybody, for joining today. I know everybody's tired, and there's nothing I can say to make that feeling go away. As healthcare workers, of course, you're not immune to the physical and mental tolls of this pandemic. I would say if you need support, you should ask a colleague. If you're struggling, there are resources available, and a few are listed on the slide you see on your screen. This is it's completely miserable that we're having to go back into such a difficult time, or at least we're anticipating that to be the case. But as I said off the top, I'm so grateful to all of you for all that you're doing for HHS, for our community, and for the region. And no matter what role you're playing at HHS, I hope you can take some pride in knowing that your sacrifices and your struggles are making a real difference for people across our region. Having said all that, I know it's just very challenging right now. So I hope you all keep supporting each other, and if we stick together on this, we'll all do much better. Having said all that, please take care of yourself, and I hope you're able, to some extent, at least to enjoy a safe and happy holiday. Thank you so much, everybody, and we'll see you in the new year.